Hello, and welcome to the Healthy Food, Healthy Farms webinar series. Today's webinar is Sickly Sweet, the Science and Policy of Fructose Overconsumption in America, featuring Dr. Robert Lustig, author of Fat Chance. I'm David Wallinga with the Institute for Agriculture and Trade Policy. Healthy Food Action is a project of IATP and is a national effort to engage American health professionals around issues in food and agriculture policy that are critical to creating a healthier food system. Today's presenter, Dr. Robert Lustig, is a pediatric endocrinologist at the University of California, San Francisco. His medical practice is in neuroendocrinology with an emphasis on the regulation of energy balance by the central nervous system. His 2009 lecture, Sugar, the Bitter Truth, has been viewed by more than 3 million people. Dr. Lustig's been the leading medical proponent of the theory that fructose consumed in large amounts can seriously harm people, especially children. His book, Fat Chance, was released this past December and expounds further on this argument. It says that the increased consumption of sweetened food and drink in the U.S., supported by industry and government policy, is behind the obesity and metabolic syndrome epidemic. Dr. Lustig is clearly a lifelong learner. In addition to having a bachelor's degree from MIT and a medical degree from Cornell, he's currently enrolled in the master's program at the University of California, Hastings School of Law. After Dr. Lustig, we'll get a 5-minute response from Stacia Clinton, a dietitian and the current chair of the Hunger and Environmental Nutrition Dietetics Practice Group of the Academy of Nutrition and Dietetics. Stacia is also the national lead on the Healthy Beverage Program of Healthcare Without Harm. Thank you to our co-sponsors for this webinar, including the National Physicians Alliance, the San Francisco Bay Area Physicians for Social Responsibility, the Collaborative on Health and the Environment, and Healthcare Without Harm. A few minutes about logistics. After Dr. Lustig's presentation and the response, I will moderate a question and answer period. But please use your chat function, your question function on the menu on the right-hand side to submit questions anytime during the webinar. In fact, the earlier the better. Look for the box labeled Enter Questions for Staff. Type it and hit Send. I'll sort through the questions and we'll cover as many as we can in the 25 minutes or so allowed. Lastly, we are recording today's webinar, and later this week we will post at healthyfoodaction.org a copy of the presentation so that you can either review it or have other people look at it who are interested. In joining Healthy Food Action, you'll be not only apprised of future webinars, but also relevant opportunities in public policy around fructose, food dyes, and other important topics. So without further ado, let me present Dr. Robert Lustig, our main speaker today. Thank you.
Thank you very much, David. Let's see, hold on, show my screen, there we go, and I guess we're off. Welcome everyone. Thank you very much for attending today's webinar. I hope in the next 25 minutes to try to convince you that a calorie is not a calorie, that very specifically sugar calories are causing harm to our nation and really the entire world. And I will try to go as in-depth as 25 minutes will allow me. I have no disclosures. Certainly no food industry is putting me up to this. What we will do today is recount some of the information that are in these two articles that have come out over the last couple of years. The first one on the left is the New York Times article called Sweet and Vicious, was about our research, and the one on the right, The Toxic Truth About Sugar, was a comment that we had in Nature magazine last year that got the ball rolling, as it were. In 2003, Thomas Baber and colleagues, public health advocates, provided us with the criteria that one needs to institute control at a public health level of any given substance. These are the following four. Unavoidability, that is, you can't get away from it. Toxicity, causes harm. Abuse, that it basically is overused and very specifically biochemically driven to do so. And finally, externalities, that is, negative impacts on society. Certainly, tobacco, alcohol, and street drugs meet these four criteria. The question is, what about sugar? And we're going to get there as we go. Start with unavoidability. All right, we're all eating more. There's no argument about that. I agree, we are all eating more. Adults are eating 187 calories more per day than they were 25 years ago. Adult women, 335 calories a day more than 25 years ago. And in this slide, you can see teen boys eating 275 calories more per day than 25 years ago. Clearly, this is why the obesity epidemic has occurred, is we're all eating more. I don't argue that. The question is, why are we eating more? What happened in the last 30 years to allow for this? People say, well, the food is there, but you know what? The food was there before, and we didn't have this catastrophe. Something else is going on. So what is it that we're eating? Is it fat? No, we're actually not eating more fat. If you look here, of those 275 calories, only 5 grams or 45 calories are in fat. And here, looking at the secular trends in specific food intake, take a look at the fats. Whole milk way down, cheese, other meats up slightly. Bottom line, it's a wash. We are not eating more fat. We are pretty much eating the exact same amount of fat. And as a percent of calories from fat, we have gone from 40 to 30% because the USDA, the AMA, and the AHA back in the early 1980s remanded us. This was the low-fat directive. And as we have gone from 40 to 30% calories from fat, our obesity and metabolic syndrome prevalence has gone through the roof. So it's not the fat that has caused this. What is it? Well, it's the carbohydrate. There's where the extra calories are. 57 grams, 228 calories in teen boys. If you look at that trend in food intake, there are the carbohydrates in red down at the bottom, all of them way up, in particular the soft drinks. And the beverage intake has increased by 41% increase in soft drinks, 35% increase in fruit drinks, fruit aids. That's where the calories really are. And what is this stuff? Well, in America, it's this stuff here, high fructose corn syrup. Current annual consumption here in the United States, 63 pounds per person. However, only the US, Canada, Japan, and very limited exposure in parts of Europe use this stuff. The rest of the world has sugar. That is table sugar, cane sugar, beet sugar, the stuff you put in the white stuff you put in your coffee, sucrose. So here's the difference. Up on the top, we have 1 molecule of glucose, a 6-membered ring. This becomes important later. You'll see why. And 1 molecule of fructose, a 5-membered ring. So high fructose corn syrup is either 42 or 55% fructose, the 5-membered ring, and not bound together. But look down below. That's sucrose, 1 molecule of glucose, 1 molecule of fructose, with an O-glycosidic linkage linking the two. The enzyme sucrase in your intestine cleaves that in about a nanosecond, and you absorb the two. So the bottom line is, high fructose corn syrup, sucrose, they're essentially the same. They're metabolically equivalent. The problem is they're metabolically equivalently bad. And I will try to explain why each of these are problematic as we go. Here is what we have done to our fructose consumption over the past 100 years. Our ancestors, about 100 years ago, getting fruits and vegetables out of the ground with the occasional honey, consumed on average about 15 grams of fructose per day. Multiply that by 2 for sugar because glucose weighs the same amount. So that's about an ounce a day. Prior to World War II, with the nascent candy and soft drink industries in America, we got up to about 20 grams per day. By 1977, before the glut of high fructose corn syrup hit our shores, we were up to 37 grams per day, and that would be 8% of our total caloric intake. By 1994, we were up to 55 grams per day. That's 10% of our total caloric intake. And currently, adolescents average 75 grams a day, or 12% of our total caloric intake. 25% of adolescents today consume 100 grams of fructose per day. Multiply that by 2 for sugar. That's 200 grams of sugar. Multiply that by 4.1 calories per gram is 840 calories. And so for a 2,000 calorie allotment, that's 40% of calories as sugar. And the question is, what does that do to you? Can you handle it? Can your liver handle that glut of fructose before something bad happens? That's the whole question here. So let's move now into toxicity. The point of this is a calorie is not a calorie. Now, lots of people will tell you a calorie is a calorie. Because after all, if you eat more than you burn, you'll gain weight. If you eat less than you burn, you'll lose weight. I don't even argue that. That's not the issue. The issue is what happens to those calories. And how those calories metabolize has everything to do with the metabolic response. And that metabolic response has everything to do with weight gain and chronic disease development. And the point is a calorie is not a calorie, and fructose is not glucose. Here's why. Fructose is 7 times more likely than glucose to bind to proteins. That's called the Maillard reaction, and I'll show you it in detail. And when that happens, it gives off what we call reactive oxygen species, little hydrogen peroxides that actually damage cells. Fructose does not suppress the hunger hormone ghrelin. So when you take in a sugar-sweetened beverage, it doesn't affect your hunger, so you actually eat more. Acute fructose consumption does not stimulate insulin and therefore does not stimulate leptin. And leptin is the hormone that's supposed to tell your brain that you've had enough. So you eat more. And ultimately, hepatic fructose metabolism is completely different from that of glucose. And I will try to show you that chronic fructose exposure alone promotes the metabolic syndrome. You don't even need the calories, just the fructose itself. All right, let's show you how this works. Here is a very complex slide that shows how the liver metabolizes glucose. You'll see glucose in the upper left-hand corner entering the liver. You can ignore the entire slide except for the big arrow in the center going to glycogen. Glucose goes to glycogen. Glycogen is liver starch, and liver starch is safe. It's non-toxic. That's why marathoners carb load before a marathon. They pasta load because they're trying to increase their intracellular glycogen. This is not a problem. However, here's what happens with fructose. You'll notice fructose does not go to glycogen. Fructose goes down to the bottom of the slide. You can see pyruvate entering the mitochondria, being converted to acetyl-CoA in that little box, participating in the TCA cycle or the Krebs cycle to generate energy. The problem is excess acetyl-CoA will be converted to citrate. The citrate will exit the mitochondria and lead to the formation of liver fat. This phenomenon here is called de novo, new, lipogenesis fat making. And you can see that the VLDL, which is triglyceride, is being exported out of the liver to adipocytes to take up as energy, and that leads to weight gain. And you can also see that some of that fat will be deposited in the liver as lipid droplets, and that contributes to non-alcoholic steatohepatitis, which is enormously rampant throughout our population, both children and adults. And that is actually leading to insulin resistance. And when you get insulin resistance, you drive high insulin levels, which then drive energy into fat and also interfere with leptin signaling in the brain, causing you to eat more, as you can see in the upper right. Now, that's one reason why fructose is problematic. Here's a second reason. What do these 5 images have in common? They're all brown. They're all brown. What is browning? Browning is the Maillard reaction. It's the reason that bananas turn brown, apples turn brown. It is non-enzymatic fructosylation, and fructose does it 7 times faster than glucose. So here's the deal. You can roast your meat at 375 degrees for an hour, or you can roast your meat at 98.6 degrees for 75 years. And the answer is the same. You brown. And if you don't believe me, here's rib cartilage at different ages, from newborn in the upper left all the way to 88 years old on the bottom right. You can see that as you age, you brown. This is oxidative stress. And if you had orange juice for breakfast, you're browning faster. This is not good because when this happens, this reduces the flexibility of the proteins in your cells and ultimately causes cell damage and cell death. Here's how fast that's occurring. If you take a test tube and you add a little protein to it, some albumin, and you add either glucose or fructose, here's how fast the reaction occurs on the left-hand side. And on the right-hand side, you can see the rate of reactivity. For glucose, 0.6, for fructose, 4.5. That's 7 times faster. And the carbonyls on the right side, that's the reactive oxygen species, 100 times more for the same amount of carbohydrate. This is a problem. And if you look in humans, here's how bad the liver fat and the fibrosis in the liver occurs based on fructose consumption. Now, granted, this is correlational data. It's very hard to get causational data, but I'm going to get you there. Okay, let's talk about exactly what's happening. Here are the 10 most obese states in the nation. No surprise to most of you. Here are the 10 laziest states in the nation. What's going on over there in Nevada? I guess they can only burn so much energy hitting the button on the slot machine. Here are the 10 most unhappy states in America. You see any overlap? Here's the adult diabetes rate. Here's the adult heart disease rate. And finally, here's per capita soda consumption. What do you see? Virtual overlap for all of these. Now, this is correlation, not causation. Agreed. We're going to get to causation in a moment. That's not just America that's doing this. This is the entire world that's doing this. Take a look at this slide. This is sugar availability per capita across the world in 2007. The American Heart Association says that we should be limiting our sugar consumption to 150 to 200 calories per day. And you will notice that virtually every country in the world is now over that limit. And now every country is showing those exact same diseases that we have. Take a look here. This is world sugar consumption tripling in the upper left-hand panel from 50 to 150 million tons per year. Per capita consumption on the upper right, Brazil is now the country that has the highest rate of increase of prevalence of diabetes in the world. Not the highest prevalence. That's reserved for Saudi Arabia, the United Arab Emirates, and Malaysia. You say, how do they do that? No alcohol. But they're drinking soft drinks like they're going out of style because it's hot, their water system's a question mark, and no alcohol. This is their reward. We're going to get to reward in a minute. This is now a very complex set of slides, and I'm going to try to go through them quickly. This is a study that was just published 3 weeks ago by our group. Sanjay Basu was the lead author, which shows that sugar is actually causative to diabetes worldwide. What we did here was we took 3 databases, the Food and Agriculture Organization Statistics Database, known as FAO-STAT. We linked it to the International Diabetes Federation, or IDF database, and then we linked that to the World Bank Gross National Income database. And what we asked was, what foodstuff predicts diabetes rates worldwide over the last decade? We had a total of 175 countries, and we did some very, very fancy statistics called econometrics. This, 2 Nobel Prize winners developed these types of analyses for evaluating what happens in markets. And most importantly, we controlled for gross national product, obesity, which is very important because after all, if it's just the calories, then obesity should correlate with diabetes. We looked at urbanization, we looked at aging, and we looked at physical inactivity as well. And here's what we found. Diabetes prevalence rose from 5.5 to 7% during that time. And here's the model. Sugar plus controls, doesn't matter. The bottom line is there was an effect of about 1% increase in diabetes rates based on sugar consumption. For every 100 calories of added sugar in the diet, diabetes rose by about 1%. And here's the adjusted association of sugar with diabetes prevalence. You can see the very clear upward swing. Here's what you need to take away from this. Only changes in sugar availability correlated with changes in diabetes prevalence. No other foodstuff even came close. If you consumed 150 calories extra per day, your diabetes prevalence went up by 0.1%, basically nothing. But if those 150 calories happened to be a can of soda, diabetes prevalence increased 11-fold by 1.1%, and in America, we're consuming 2.5 cans of soda per day, or 2.75%. Considering our diabetes prevalence is 7.5%, you can see that 1/3 of our diabetes is due to sugar alone. These data, because we had dose data, we had duration data, we had directionality, that is, those countries where sugar consumption went up showed increasing diabetes, those where it went down showed decreasing diabetes, and most importantly, we had precedence. That is, which came first, the change in sugar or the change in diabetes? We were able to look at that because we had the whole decade, and it turned out the change in sugar occurred 3 years before the change in diabetes. We had what is essentially causal medical inference. It is not scientific causality. You have to do intervention studies to do scientific causality. But this is causal medical inference. This is the same level of data analysis that we had that linked tobacco to lung cancer back in the 1960s. And we controlled for every confounder. Obesity exacerbated the problem but did not confound the effect. Sugar was toxic by itself. And we estimate that 25% of all diabetes worldwide is from sugar and sugar alone. Now, there are lots of limitations to this kind of study. I'm not going to go through all of these. They'll be on the webinar posted on the online. But the bottom line is we're recognizing that there are limitations. It doesn't matter. The data is so robust as to be essentially slam dunk. Bottom line, it's not just sugar. There are 4 foodstuffs that do the same thing to liver mitochondria to cause this problem. Trans fats do it. Branched chain amino acids, leucine, isoleucine, and valine do it. Where do you get those from? Corn-fed beef. Alcohol, but kids don't drink alcohol. And finally, fructose. And the reason is because there are 3 things they have in common. The liver is the only site for energy metabolism. All the energy goes to the liver, overwhelms the liver's mitochondrial capacity. It's not insulin regulated, and there's no glycogen pop-off, so the mitochondria overwhelmed have no choice but to take that energy and turn it into liver fat, driving the phenomenon. Here's how this all works. Here's fructose up at the top. This is a liver cell. The fructose comes in, gets glycosylated, as you can see, that NH2 bound to protein. That generates reactive oxygen species, or ROSs, there in the center. On the mitochondrial side, any acetyl-CoA is going to generate ATP, but ROSs get made as well. And finally, the laying down of visceral fat in the belly generates inflammatory cytokines, which react with its receptor on the liver, generating more ROSs. Those ROSs are going to cause damage unless they're quenched, and they get quenched in the peroxisome. That's where they go to die. That's that yellow X there. But if they don't get quenched, then they go to the endoplasmic reticulum, where they engage in a phenomenon known as the unfolded protein response. This is where insulin can't fold on itself. And when it can't fold on itself, it can't make the normal tertiary structure, and that will lead to cellular metabolic dysfunction, i.e. diabetes, or cell death. In addition, the acyl-CoA will come down from the mitochondria and form lipid droplet because of the de novo lipogenesis, and that interferes with insulin signaling. Now you have hepatic insulin resistance. We believe this is the pathway to metabolic syndrome. All right, next, abuse. Everybody seems to know that sugar is addictive. How come the scientists don't know? Here are a whole bunch of lay articles, lay books, basically trumpeting this issue. If you take a look at the brain in patients who are drug addicted, what you see on the left is that dopamine D2 receptors in the reward center go down, the nucleus accumbens. You can see the red on the control brain. That's because there's robust production and expression of dopamine receptors. But look at the cocaine brain. They've been way down regulated. Now look at the right side. Look at the control brain and look at the obese brain. What do you see? See the same phenomenon happening. So is there really such a thing as sugar addiction? In order to evaluate this, we need to look at similarities to other drugs of dependence. For instance, nicotine, morphine, amphetamine, cocaine, cannabis. The one I think is the best analogy is alcohol. And the reason is because that's how alcohol gets made, fermentation of fructose. It's called wine. We do it in Napa Valley every day. Here are the criteria in animals that you have to meet in order to be called an addictive substance. Binging, withdrawal, craving, and finally, cross-sensitization with other drugs of abuse. That means you addict the animal to one drug over 3 weeks, then you expose them to a second drug they've never seen before, and they're addicted to that one too. And you evaluate that by enhanced locomotion and increased consumption. Bottom line, without showing you all the data, sugar does the exact same thing, all 4 of these. What about in humans? Well, here are the criteria for humans. Tolerance and withdrawal, and we have data supporting both of those in correlative studies, not causative yet, and all these psychological dependencies. And if you read through each of these, basically it reads like every obese patient I've ever taken care of. Lastly, externalities, negative impact on society. Societal intervention means what you do hurts me. So if you smoke or drink or take drugs, it's bad for me. So secondhand smoke causes me asthma and lung cancer. If you drink, you get in a car accident, you kill me. That's not okay. If you open up a crack den next door to my house, that leads to declining housing prices and altered work productivity and absenteeism for each of these. So we regulate tobacco, alcohol, and street drugs. So how does your obesity affect me? $274 million extra for jet fuel? That ain't going to do it. Discomfort on the subway? That ain't going to do it. Sinking of boats due to the weight. 2003, Lake George, a boat was coded for 175-pound people, 17 of them. They put 24 200-pound people on, the boat sank. That ain't going to do it either. Here's the reason. $65 billion reduction in work productivity, 50% increase in absenteeism, 50% increase in health insurance premiums, $150 billion of wasted in healthcare resources, now up to $192 billion. Obesity is a threat to national security because 27% of recruits can't pass the phys ed exam because of obesity, and ultimately the government pays twice. They pay for the corn subsidy and then they pay for the ER visits, and it's breaking the bank. There will be no health care. Medicare will be broke in 2024. If your obesity doesn't affect me, I don't know what does. And here's how your food dollars have been reallocated for this to occur. Notice, in 1982 on the left, meats, 31.3% down to 21.5% because of the low-fat directive. Fruits and vegetables about the same. Grains and baked goods about the same. Dairy products down a little because now everyone's lactose intolerant. But look at processed foods and sweets. Doubled in the last 30 years. That's where the money is going, and that's why the food industry is making money, and that's why we're getting sick. Bottom line, everyone considers obesity, metabolic syndrome, personal responsibility. Well, here are a bunch of other diseases that were all personal responsibility before they reached a level where, bottom line, we had to institute public health interventions, and every one of these required legal challenges: syphilis, cholera, lead poisoning, TB, foodborne illness, vitamin deficiency, AIDS, and pollution. Bottom line, obesity, metabolic syndrome goes on this list, and sugar is the driving force. American Heart Association recognizes this. Currently, they recommend reduction from 22 teaspoons per day average down to 9 of added sugar for males and 6 of added sugar for females, a reduction by 2/3 to 3/4. How are we going to get that done if the food industry doesn't go along when they've been the ones spiking the processed food? So my question to you is, can our toxic environment, our food environment, be changed without governmental and societal intervention, especially if there are potentially addictive substances involved? And the second question, can we afford to wait to enact these public health measures when healthcare will be bankrupt due to chronic metabolic disease? For further reading, a bunch of studies that we've done, more studies that we've done, more studies that we've done, more studies that we've done, including the one that I mentioned in +1 on diabetes, and finally some non-academic stuff for you as well in the book Fat Chance, which I hope you'll all purchase and read. With that, I'll be glad to turn it back over to David and to Ms. Clinton.
Thank you. And that was a great overview, and I really appreciate sticking right on schedule as well. We've had a lot of great questions come in. Keep them coming in. But first, we are going to get a response from our second presenter, which is Stacia Clinton. And Stacia is a registered dietitian and the current chair of the Hunger and Environmental Nutrition Dietetics Practice Group of the Academy of Nutrition and Dietetics. And she's also with Healthcare Without Harm, where she's the national lead on the Healthy Beverage Program. So Stacia?
Thanks so much. And I'd like to thank you for this opportunity to provide perspective on such an incredible presentation. So first, I'd like to emphasize some of the wonderful things that were said today by our speaker, the value of the discussion of the causal impact of sugar on our bodies. I think historically there has been some concern around the conversation of the discussion around one food being good or bad, but we're starting to see strong research emerging around the formulation of certain food and food products really directly impacting our health and leading to chronic disease, as Dr. Lustig has presented quite well today. Nationally, our communities and our institutions within them are looking to support the prevention of chronic disease rather than just simple Band-Aid as they have done in the past. Looking at opportunities through policy that reduce access to these beverages that have been linked to some of these illnesses. But there's also a look at the broader system that Dr. Lustig had alluded to that supports products like these as part of our traditional diet. So there's a need for reform of our health care that includes a reform of our food system, the process of creating nutritious foods, as well as marketing and education by the industry. Healthcare Without Harm's Healthy Beverage Program addresses these issues in the context of a healthy food and beverage environment in a healthcare setting. There is a great opportunity for hospitals and the clinicians working within them to model healthy behaviors through the products offered and the recommendations and education that they provide. And some of the nation's leading hospitals are really stepping up to the plate and really providing excellent opportunities to showcase programs and education and modeling the purchasing practices that you would like to see in a healthy home. So when we look at really entertaining the idea of healthcare reform, we really want to look at a reform of the entire system that we're exposed to, from the foods that we're eating on our plates to those foods that we might be exposed to in terms of the food packaging as well as the advertisement that we are also exposed to. So with that, I'd like to entertain any questions that you all have today on our speaker. And I'll turn it back over to David.
Thank you. And I think there's going to be questions for both of you. And thank you for listening to my request for questions. We've got a flood of them coming in, so I'm going to try to take some of the earlier ones first. Let's start off with some good sort of basic questions. Dr. Lustig, it seems like the health impacts that you describe are more of an adult issue, and I think this was the focus on diabetes and obesity, but the focus seems to be overly directed to children.
Well, I don't think so.
On that?
I wouldn't say that at all. I think this is a problem for both. Here's a question. How can children get metabolic syndrome? If this is a problem of aging, if this is a problem of obesity, how are children getting metabolic syndrome in such high numbers? The fact is that when you do autopsy studies of kids dying in car accidents, 13% of them have fatty liver, and 38% of obese children have fatty liver, just from random car accidents. So this is going on at every level. Another question. Babies born today are 200 grams heavier than they were 20 to 25 years ago worldwide. Israel, Russia, United States, Brazil, every baby is now heavier at birth. And the question is, what is that extra weight? It's fat. For DEXA scanning shows that this is fat. This is not muscle. So we are generating babies that have an increased amount of fat deposition automatically right before they're even born. And what do you think that those fat cells want to do? They want to get filled. And so it should be no surprise to your audience that we now have an epidemic of obese 6-month-olds. So this is a problem for babies, this is a problem for children, this is a problem for adults, this is a problem for the woman before she ever even becomes pregnant. Bottom line, it's a problem for everybody. I do not make specific reference to any specific age group. This is a problem no matter where you live in our society.
Right. And here's a couple of linked questions from Chris Solid and Amy Ziff. And it goes to sort of these consumption limits that you brought up. I think the American Heart Association was one of them, but 150 to 200 calories per day of sugar.
Added sugar.
One question, excuse me?
Added sugar.
Added sugar, right. So I think that
we're not talking about the sugar in fruit.
That was the first question. And the second question, I I'm sorry, I just lost it. The second question is, for historical context, could you comment on when the U.S. sugar consumption was last at the 6 to 9 teaspoon level suggested by the AHA?
That was back in prior to World War II.
Okay.
It's been a long time coming that we've been going higher and higher. But, you know, that's when cardiovascular disease started becoming such a big problem, was in the 1950s. And the thing that drew attention to it was when President Eisenhower had his heart attack. And that was the thing that got the national conversation going as to what causes heart disease. And, of course, there were two factions back then. There was the fat faction that was led by Ansel Keys, and there was the sugar faction that was led by British nutritionist physiologist John Yudkin. And there was a battle royal that occurred during the 1960s and into the 1970s. There were three things that ended up sealing the fat hypothesis as the problem back in the 1970s. The first was the discovery of LDL. And LDL was discovered by Brown and Goldstein, and they also discovered the LDL receptor. We knew that patients with familial hypercholesterolemia had heart attacks, but by the time they were age 18, now that's about a 1 in 500 incidence in the population. And of course, those patients needed to be on a very low-fat diet, and still they had heart attacks. The second thing that happened was we learned that dietary fat raised your LDL back in the mid-1970s. And then finally, we learned that LDL levels in populations correlated with cardiovascular disease. So if dietary fat raised your LDL and LDL correlated with cardiovascular disease, the goal was get dietary fat down, lower your LDL, and reverse heart disease. Did it work? Not a bit. Because what happened? When you took the fat out of the food, it tasted like garbage, it tasted awful. So what did the food industry have to do? They re-engineered the food and they to be low fat, but they had to make it palatable, so they went high on the sugar. And that's what started the obesity metabolic syndrome epidemic that we now continue to find ourselves in. Bottom line, it won't change until we get the sugar out of the food. To be honest with you, which was worse, the fat or the sugar? We now know that there are many different kinds of fats. There's omega-3s, which are not just heart healthy, but they'll save your life. And there's also trans fats, which are the devil incarnate, and they'll kill you. So when you remove all the fat, you're removing the good fat too. So we need to rethink our entire food paradigm. We need to rethink, as Ms. Clinton said, our food policy. We need to rethink the Farm Bill. We need to rethink our agricultural policy. We need to basically we need to wipe the slate clean and start over.
Great. Let's have one question kind of going into the nitty-gritty of the science presented. The BASU slide, the questioner, Richard Feynman, says, doesn't the BASU slide have tremendous variability since you don't know that fructose is causing diabetes, and given that diabetes is more closely linked to glucose, i.e. insulin, it is almost as likely from the slide that people will do better by adding fructose so long as it's done at the expense of glucose. Isn't that right?
All right. So first of all, Professor Feynman and I have had many discussions and debates on this issue, and I will try to limit myself to the science here. There is no question that glucose causes insulin secretion, which causes weight gain, and Dr. Feynman and I both agree on this point. It is not like glucose is completely safe. It's just that fructose is more problematic from a metabolic standpoint. The problem with using fructose alone is that fructose alone causes tremendous diarrhea and GI symptomatology. Turns out that if you use fructose alone, what seems to happen in the intestine is that fructose gets phosphorylated to fructose 1-phosphate, which depletes ATP, causes breakdown of the tight junctions in the intestine, which leads to leaky gut and causes a tremendous amount of GI distress and diarrhea. This is the reason that fructose alone has not become a sanctioned sweetener that's been used by the food industry. Don't you think that if they could generate increased sweetness, they would by doing so? It hasn't happened because our GI tract can't deal with it. So we do not really have rational fructose alone studies because we can't tolerate it. Dr. Feynman is absolutely correct that glucose does generate an insulin response. Ultimately, the more insulin generated, the more burden that's put on pancreatic beta cells, and there's no question that that also contributes to the genesis of diabetes. I don't argue that. Well, sugar is both glucose and fructose. In fact, we're not talking about two separate foodstuffs. We're talking about one. So everything Dr. Feynman says is extraordinarily well taken. It doesn't change the fact that sugar is the problem.
There's a couple of questions that seem to go back to the age of the data on sugar consumption, and I think the points are, basically, have we peaked, and are we on the downward side of the slope in terms of sugar consumption? What are the latest USDA statistics on sugar consumption? And I gather, should we be heartened by the level of sugar consumption now versus maybe in the 90s?
Right. That's a really very good question. At its peak, which was around 2000, our sugar consumption was estimated by the USDA Economic Research Service to be at 140 pounds per year. Right now, we're about 130 pounds per year. So there has definitely been a decline, and the decline has primarily been because we have many people have switched to diet drinks. Diet drinks now account for 42% of soda consumption in America. So that's where the primary issue has occurred. However, it has not yet been taken out of any of the foods. If anything, it keeps being added to the foods. Perfect example of that would be yogurt. Take a look at the yogurt and how much added sugar there is in yogurt. So yes, total consumption, if you take the soft drink issue to heart, is down, and that is certainly a good thing. However, we are still way over our limit. If we are supposed to be consuming about 200 calories per day in added sugar, we should be below the 40 pound per year level. We are at the 120 pound per year level, or 130 pound per year level, and that is still triple what we should be consuming. According to the AHA, we should be below 50 pounds per year, and we are at 120. So we are still way over our limit. The other question, of course, is that with respect to diet sweeteners. Does it make sense to remove all the sugar and replace it all with diet sweeteners? And the answer, in short, is we don't have the data to know whether that's a good thing or not. And it's actually maddening that those studies are not being done, because the Food and Drug Administration doesn't require them to get a diet sweetener on the market. The food industry can't sell more by doing so, and the NIH won't pay for it because they say it's the food industry's job. So we have an impasse on diet sweetener research.
So that I'm glad you mentioned the diet sodas, because there's several questions about either non-sugar sweeteners and their level of toxicity. Agave is mentioned. What do we make about agave being marketed as low glycemic? Saccharose, does that have the same effect as fructose? And what about diet pop? Should we be worried about drinking too much diet pop?
Look, to be honest with you, I think we need to de-sweeten our lives. Sugar used to be a treat. It used to be a once-a-week deal. When I was a kid, my grandfather took me to the local soda shop on a Saturday, and that was the only time I ever had a Coke, and it was 6.5 ounces, those real little ones, and that was okay, and that was fine. And the reason it was fine was because it wasn't every meal. It was, it was once a week. Now it's once a meal, or sometimes more often than that. You don't get to 100 grams of fructose per day by accident. This is what's in the food supply. Barry Popkin did a study in the Journal of the A&D showing that of the 600,000 food items that are currently available in the American food supply, 80% of them have added sugar spiked in them. That's not an accident. That's very much on purpose. And the point is, we will not turn this around until that phenomenon is changed.
So I want to move a little bit into some of the policy questions. Let's see. well, let me just wade into the controversial side. But what's your opinion, Dr. Lustig, about, and Stacia Clinton too, feel free, about the SNAP program? Should it be modified based on this information? SNAP is the food stamp program.
Well, as you know, Mayor Bloomberg tried to get sugared beverages off SNAP back in 2011, and the USDA was lobbied by the food industry so hard that basically Bloomberg was rebuffed. I thought that was an excellent idea. I thought it was a great idea. You know, the bottom line is SNAP is to try to nourish the population, especially the poor population. But if fructose is not nourishment, I don't think sugar beverages should be on that list. Fructose is energy. I'm not going to argue that. But fructose does way more damage than it does good. There is not one biochemical reaction in your body that requires dietary fructose, not one. There is a disorder, there's an enzyme disorder that I take care of called hereditary fructose intolerance, or HFI. These are babies that are born without an enzyme in the liver known as aldolase B, and they become massively hypoglycemic and often die at around age 6 months when their parents first add sugar to their diet. They are then on a sugar-free diet the rest of their lives. There is a cadre of these patients that are run in a registry out of UC Berkeley. These are the healthiest people on the planet. And I mean this very seriously. These people are extraordinarily healthy because there is no requirement for dietary fructose. None, zero, zilcho, nada. So is dietary fructose a nutrient? Is it something that we should be giving out if it's got potential detriment on a SNAP program where poor people are getting sick with every one of these chronic metabolic diseases and costing Medicare and Medicaid in enormous amounts? I think not.
I think that in there too. There's a strong interest from those working in the food security sector to improve the healthfulness of foods provided through donation and public assistance programs. The Environmental Working Group just released a great resource called Eating Well on a Budget that looks at trying to make food choices that are healthy and free of additives and added sugars and reduced in salt and able to be purchased on a SNAP budget. And I think what we're finding is that there's a conflict in education about what healthy food is when programs like these support the provision of items linked to obesity and chronic disease. We get kind of this hungry but overweight paradigm that we see many politicians talking about these days.
Well, in fact, that hungry but overweight paradigm is exactly what's going on, because if your brain can't see your leptin, you're starving. And that's exactly what's going on. So anything that drives insulin up, because insulin blocks leptin signaling, this is our research, and it's been corroborated and verified in numerous basic science labs. Insulin blocks leptin signaling. So the higher your insulin goes, the less your brain can see your leptin, the hungrier you get. So you end up, as Raj Patel put it in his book, stuffed and starved, all at the same time. Bottom line is, we got to get the insulin down, and the thing that makes the insulin go up the most is refined carbohydrate, glucose by inducing insulin secretion, fructose by inducing insulin resistance, and sugar is both.
So you said fructose isn't a nutrient, but a similar question that's being raised is kind of flipping that and talking about fructose as a toxin.
Yep.
Is there a safe level of fructose, or for that matter, sugar consumption?
Yes, of course, and we used to have it. The bottom line is our liver is able to metabolize a relatively large, and when I say large, I mean in terms of calories, a large amount of fructose per day. It's one of the reasons fruit's on the planet. If we couldn't metabolize fruit, I guarantee you we'd all be dead. So we are able to metabolize to a limit. Our mitochondria have the capacity to metabolize some sugar, no question. And there are 4 things that increase your metabolism of any substance in your liver. One is cold. That's why Colorado is less obese. One is altitude. That's why Colorado is less obese. One is thyroid hormone, but we can't give thyroid hormone to people. We tried doing that to obese women in the 1960s. We made them very crazy. And the last one is exercise. Exercise increases mitochondrial tricarboxylic acid cycle kinetics. So the best answer is exercise vigorously, consistently, as you possibly can. You will increase your capacity to metabolize fructose so it never gets turned into liver fat. So your de novo lipogenesis won't occur, and it will keep you healthy and insulin sensitive without fatty liver, and will go a long way to increasing longevity. So I'm totally for exercise, but not because exercise promotes weight loss. That's a joke. There is not one study, not one, anywhere in the world's literature that shows that exercise alone promotes weight loss. If anything, it promotes weight gain because it promotes the building of muscle, and muscle weighs more. So if you stand on the scale, you'll think you failed. In fact, you've succeeded. But the doctor goes to, tells you, hey, if you'd only exercise, you'd lose weight. And then when you don't, you get tired, you get depressed, and you stop doing it. As far as I'm concerned, it's the biggest affront that the medical profession has perpetrated on its populace.
So then it sounds like there's not like a threshold of safe sugar or fructose consumption. It depends on these other factors like exercise and where you live, and
it depends on many things. It's a grab bag, and everyone's got a personal fructose threshold. And if I gave you a number for any given person, it would be wrong. And so I'd rather not do that. What I can say is that the American Heart Association says 150 to 200 calories of added sugar per day. And I have signed on to that, and I do believe that's a safe level.
Right. So, Stacia, how do we convince RDs to spread the word when especially given the other pressures at play, such as, for example, these large beverage industries? That's
so. I think number one, it's revealing the robust science, some of which Dr. Lustig revealed today, but just outlining and discussing the clear lines that are being drawn between sugar and, again, sugar-sweetened beverages in particular, and the development of chronic disease. So registered dietitians in particular and other medical professionals, science speaks very strongly. So that's number one. And then number two is also looking at the evidence of removing some of these products. We have some real champions that are looking at public health interventions of reducing access to sugar-sweetened beverages in different arenas and looking at how that improves health. And I think that that's an opportunity for registered dietitians who are essentially public health professionals to look at the opportunity to improve health and improve overall the nutritional profile of a person's diet by reducing added sugars, not only from those beverages, but also to improve the composition of what they're actually consuming.
I couldn't agree more. I totally agree. That's exactly what needs to happen. And Ms. Clinton, you said the magic words there, which is reducing availability. That's exactly right. This is exactly how we worked with tobacco and with alcohol too. There are many ways to reduce availability. One is taxation, one is restriction of access. Then there's government intervention. I mean, as far as I'm concerned, I'm willing to entertain any and all of these. But ultimately, the only way we're going to solve the problem of something that's both toxic and addictive is by reducing availability. And I'm very pleased to hear you say that. The problem that I have is that so many people, and you'll forgive me, many dietitians still believe a calorie is a calorie and that any calorie can be part of a balanced diet. This is exactly what the food industry wants you to believe, because if that's the case, then sugar is just empty calories, and you should be able to spend your discretionary calories on anything you want, including sugar, and we do, and then some, and then some. And that's the biggest problem, is by allowing for that mantra, a calorie is a calorie, to continue to be the law of the land when it is absolutely fallacious dogma. That is how we've gotten into this mess, and it is only when we reverse that that we're going to get out of it.
Well, I think partnering, I think, you know, being in line with the food industry itself is creating products in order to sell them and to make money. And so I don't think they're in the business of public health. And when a dietitian, you know, if a dietitian is making a recommendation, first and foremost, the recommendation is to create a diet that is nutritious and has, number one, the amount of calories that a person needs, as well as the vitamins and minerals and total nutritional composition that a person needs. You know, and I have heard that, you know, as you mentioned, is there a threshold that a person can consume a certain amount of sugar or fructose a day? And it's variable to everybody's personal intake. And I think that the industry itself has gone wild with some of the recommendations saying that, well, you know, any product can fit into a healthy diet. And the problem with that is that people aren't consuming them as part of a healthy diet. They're consuming them much more than that, and that's where our problem has come. Instead of being an occasional treat or something that we consume very rarely, they've become our standard traditional diet, and that's where we've seen the challenges with our obesity and chronic disease that we have today.
Well,
so we really need to look back to the basics of our diet in terms of foods that are naturally free of added sugar, naturally low in salt, and how those are naturally nutritious rather than those products that need to be reformulated to be so.
I'll take that one step further with our last minute here. Of those 22 teaspoons that the American Heart Association says we currently consume, 1/3 of those teaspoons are in soft drinks and fruit juices, beverages. 1/6 are in desserts and things you would normally recognize as being sweet, having sugar like ice cream. That means fully 1/2 of the added sugar in our diet is in things you didn't know had sugar, like tomato sauce, barbecue meat, sauce, hamburger buns, hamburger meat, bread. The bottom line is you don't know how much you're consuming, and that hidden sugar is the biggest problem.
So what do we say about what do we tell people, or how do we respond in policy terms to fruit juice? Like, for example, should we be looking more closely at fruit juice or flavored milks in the WIC program or in school?
Absolutely. Absolutely. As far as I'm concerned, bring back whole milk.
And the other thing is, this is a policy question, but you made the analogy, Dr. Lustig, to our experience with tobacco, which is obviously addictive and was kind of a core piece of the marketing strategy. What do we know about the food industry and processed food in terms of how much the industry knew about addictive qualities of fructose or sugar?
We don't know any of those things at this point. The only thing we know for sure is that the food industry knows that when they add the sugar, we buy more. That they know, and that's the reason they do it. Whether or not we will ever find the smoking gun that says that they knew that sugar was addictive and that's why they added it to all the food, just like they did with tobacco, adjusting the nicotine levels very specifically to hook people and keep them hooked. My guess is we'll never know that, and the reason we'll never know that is because the tobacco industry is the food industry. You think they're going to make the same mistake twice? You think they're going to leave some documents lying around for us to find? Bottom line is we have to start from scratch here, and because food is so much more problematic than tobacco, because we do have to eat and we do need a food industry, this will be a much tougher battle and will take much longer even than the 40 years it took with tobacco.
I think, unfortunately, we need to look at our foods today and with a very critical eye. We need to look at, you know, if a food is saying it's health promoting, if it's natural, if it's, you know, promoting, you know, having fiber and such. We need to look at, does that make sense? And, you know, is that something that really should be there, and why is it saying it's helpful for me? Because as I mentioned, you know, those that are making these claims, it isn't necessarily in our best interest, rather than looking to sell the product. So I think that we need to be our own promoters of our own health and really investigate what is healthy, and look into some of these recommendations in terms of consumption of sugars and salts, and start to take a critical eye in the types of foods that we're consuming.
Well, I have one last question and comment. This is a vascular surgeon who, first of all, wants to thank you both for your courage and voices for national reform to care for the patients we serve. But their question is, how can we as health professionals impact our provider colleagues who are often the biggest barriers to institutional change and reform?
I'm going to make a plug. Send them my book. Buy the book for them, put it on their desk, and say, read the damn thing.
What I'd like to say is that I'd like you to find an ally, another colleague of yours that feels similar, and there's many of you out there. Healthcare Without Harm works with many other clinicians that feel similarly, that there needs to be a change specifically within the healthcare sector to be that voice, to model healthy behaviors for their community, and there's an opportunity to collectively use that voice to shift not only internal policy within your healthcare setting, but also policy at a state, local, and federal level.
Well,
I will say that hospitals are starting to rethink having sodas in their cafeterias, because we have to model for the rest of the country.
Thank you both to our speakers, and I want to just finish by mentioning again, because many of you had asked, that we are recording today's webinar, and later this week at healthyfoodaction.org you will be able to see a copy of the webinar to either review it and gain a closer look at the slides, or to share it with colleagues. By joining Healthy Food Action, you'll not only be apprised of future webinars, but also get access to these and other past webinars. So thank you, Dr. Lustig. Thank you, Ms. Clinton. Really appreciate your time.
Thank you.
Thank you.